Welcome to the Brain People Podcast, a show where four mental health experts team up to bring you practical tools for overcoming mental health challenges. The Brain People don't replace your doctor or therapist, but we will give you some extra tools to help you on your journey. So join us as we fight mental illness, one episode at a time.
Welcome to the Brain People Podcast. I'm your host, Amanda Anguish, licensed marriage and family therapist, and I'm with my co-host.
Hi, everyone. My name is Dr. Katie Cruz. I'm a licensed clinical psychologist.
And today we're talking about something abbreviated CPT. Not something, I do know what we're talking about, but do you want to tell us what that stands for?
Yes, and some people might get confused because it sounds very similar to CBT.
Yes.
And that is something we talk about a lot,
we do.
But we're going to be talking about CPT, cognitive processing therapy.
Mm-hmm. So would you say, just real quick before we kind of get into the why, but would you say that CBT is the umbrella term and then CPT is underneath that along with a lot of others?
Mm-hmm. Yeah,
Okay.
so CPT did come out of CBT. So cognitive processing therapy came out of cognitive behavioral therapy. Yes.
Mm-hmm. Okay, so now that we have that taken care of and people aren't confused, what got you into studying or learning more about and even using CPT in your practice?
Yeah, so it's a long story, but basically my background was health psychology. So I worked in a lot of hospitals, primary care places, clinics, and such. And in my hospital experience and the primary care experiences, we would start recognizing a lot of comorbid depression, anxiety, and other symptoms and other mental health conditions with physical ailments. And I remember at that time, it was kind of at the time where they were trying to integrate psychologists more into those settings, but it was still kind of separate. Okay, they struggle with this and they have this physical ailment. And we started realizing, okay, there may be some relationship between diabetes and depression, chronic pain and depression and other things. But I realized I started to understand that there was a trauma component, the trauma that was connecting the two. Now, that's not always the case, but a vast majority. And so that started getting me interested in trauma. But it wasn't until I had an experience of working in the VA with veterans that really magnified trauma and then led me to studying and then practicing cognitive processing therapy. So it wasn't until actually explicitly working with trauma that I was trained to use this treatment, and I just fell in love. I was like, one, trauma is really the root to many of different difficulties. And then on top of that, too, seeing a treatment that really addressed the root of trauma. Because there were different treatments that I was exposed to and trained in, prolonged exposure and so forth. Maybe we could do a whole episode on those different treatments. But to me, CPT addressed some of the roots of the trauma, and then the way that they conceptualize the problem and then maps on the solution to that, I thought was just so beautiful. And then when I started doing it with clients, I was astonished to see how well it worked.
So you mentioned that you really started getting into it when you're working in the Veterans Hospital, but a lot of people think trauma, whenever we think of trauma, we think of like, oh, military and that sort of thing, but you probably know how much trauma is just related to military versus other types of trauma.
Yeah, so you make a good point, and this is often the point I make when talking about complex PTSD, is unfortunately a lot of clients get misdiagnosed with just depression, anxiety, or even times personality disorders, psychotic disorders, and others that are actually better understood as complex PTSD. And why? Because we have an incorrect definition of trauma. We think of trauma being combat.
I was in war and that sort of thing, yeah.
Combat or even sexual abuse, rape, kind of these really big extreme one-time events,
Acute trauma.
acute trauma versus ongoing chronic trauma. And then also it's the difference between type A and type B trauma, right? When we think about, yes, bad things can happen to you, but also the absence of good can really negatively impact someone's mental well-being. And so
Yeah.
CPT addresses all different types of trauma. Now, it, of course, in my experience at that time was very focused on combat trauma and others, but linking, because this is often there's a link between veterans who experience combat trauma and already being vulnerable because of their past trauma. And we could have a whole conversation about how they're led to the military often because they're trying to heal some of their past wounds and so forth. But CPT addresses all kinds of trauma, not just combat trauma.
So that's a nice segue, because what is CPT then?
So cognitive processing therapy, as we mentioned, came out of CBT, CBT being a very good evidence-based practice for a lot of different disorders. But a lot of times with CBT, when it's so general and it works well for depression, anxiety, and so forth, it doesn't address specifically the trauma roots. And so cognitive processing therapy is specific for trauma. It's an evidence-based practice, about 12 sessions. And it addresses trauma in a very focused way.
So what are the components? Because anytime I want to know about something and I look it up and they're like, oh, generally speaking, this is what it is. I want to know, like, no, really, how does it work? So what are the components of CPT?
Yeah, and that's a great question that clinicians can ask, but also clients.
Yeah, what should I expect if I'm getting trauma therapy, CPT therapy?
And asking that from the perspective of them understanding why it works. And so this is one thing I love about CPT is actually the very first element of CPT is psychoeducation. So a lot of time is spent in educating clients, what are your symptoms of PTSD, but then also giving them the why they're struggling.
Yeah.
So one of those elements, and I want to go there for a moment because it's really important, is a lot of times people think that trauma or why they have PTSD, why they have complex PTSD or depression, anxiety, whatever the effects of trauma is for that person, they think it's because of the event.
The activating event, we would say, in cognitive behavioral therapy.
Yes. And so it's this idea, oh, well, I experienced this negative thing, right? That caused my PTSD. One of the examples I use for that to help people recognize that it's not the event is 9/11. In 9/11, a lot of people experienced trauma, right? Very traumatic, life-threatening. People actually died, witnessing people dying, people falling from, the skyscrapers and so forth. A lot of different trauma. The people that were there, people that watched it, people that were first responders. And yet, when they have done studies, follow-up studies, they only found about, and I'm rounding up, 5% of individuals, and I think it was about a 7 to 12-month follow-up, who had PTSD symptoms.
And that's a common misunderstanding because a lot of people think that the trauma, like you said, automatically means I'm going to have these symptoms and I'm going to be fearful and nightmares and all that stuff. But they show even in the military, people who are at war like daily and monthly and yearly, not every single one of them experiences PTSD.
So that begs the question, right? If it's not the event, what is it?
What sets people up for this?
So there's three main kind of clusters of symptoms or kind of problem areas of PTSD. There's the intrusions, right? The intrusive memories, the intrusive thoughts, even kind of feelings as well. Well, that would go more so with the second thing of arousal, the feelings that come along with PTSD. And then the third one is the memory. The actual memory of the event. So it's not the event itself, but the memory. Now, those are the three main things. What happens over time naturally for people, as we cope and we heal from that experience. So let me pause for a second. We cannot diagnose PTSD within for at least 1 month.
Yeah.
And
It's just adjustment disorder.
Exactly, because what that's saying is we expect people to have PTSD symptoms.
It's normal.
It's normal. But what happens after the month? What we call PTSD a non-recovery diagnosis, meaning
I like that. Yeah.
Yeah, we would expect people naturally as human beings that are extremely resilient to heal. So what would happen is that the arousal would diminish and the intrusions will also diminish. And so you're left with the memory. So that's healthy healing. That's recovery from trauma. So the question is, what gets in the way? What gets in the way? It's not the trauma itself. What gets in the way that leaves the intrusions and leaves the arousal?
I know where you're going with this. So what is it?
Avoidance. Avoidance gets in the way. So it's another way to conceptualize trauma is grief. We are grieving something when we experience trauma. And if we naturally grieve, we heal from grief. But with trauma, something gets in the way. Often, and this we'll use the veterans for an example. They start drinking. They come back from combat. They start drinking
to avoid having to think about it.
They engage in risky behaviors and fill in the blank with whatever avoidance it may be.
Yeah.
Another key element of PTSD is they avoid any sort of reminders. So I had some Vietnam vets that would really avoid any Asian individual right, because it reminded them and took them right back.
And that could be seen as racism too.
Yes. And they were not intentionally being racist, although there were a few.
Yeah.
But it was such a reminder and a fear of it taking them back to that trauma.
A trigger.
A trigger, exactly. So knowing that the avoidance gets in the way, which also applies to other disorders, OCD and so forth, avoidance gets in the way of healing. I love that there's a quote that says, we can avoid reality, but we cannot avoid the consequences of avoiding reality.
Yeah, it's true.
And one of those consequences is living in trauma for the rest of your life if you don't heal from it.
Yeah, that's very true, because you see people living with trauma the rest of their lives when they try to avoid it. And sometimes the reason they're trying to avoid it is because in a very real sense, they don't know how to deal with it.
Yeah.
Or they've never been taught that it's okay to go through this process and feel the feelings and that sort of thing.
I think what's helpful for people to understand is what happens in the brain with trauma. When we experience something extremely traumatic, our limbic system, right, the emotional centers of our brain are strengthened. The network in that area of the brain is strengthened and the frontal lobe is weakened.
Yeah.
So what happens is when our frontal lobe is weakened, most likely we're very vulnerable to creating incorrect cognitions about the trauma. So this is where
emotional reasoning.
Emotional reasoning is a big part of it for sure, because we're going based off of what our limbic system is telling us.
I'm fearful, therefore there are a lot of fearful things. There must be a lot of fearful things around me.
And now so that happens naturally in our brain, and that's really adaptive. So don't hate your brain because that's happening.
It's to protect you.
Yeah, you need to respond quickly. So you need your limbic system reacting. You need your amygdala to be firing with fear and so imagine, a veteran in that combat zone, you need to be reacting. You do not need to be paused and
let me have
my frontal lobe thinking.
I'm going to have some tea and think about this for a little while.
Exactly. So it's very adaptive. But when we experience trauma and then we create a stronger network in our limbic system and a weakened network in our prefrontal cortex, then what happens is that carries on. But then a big part of CPT, the conceptualization of the problem, is that, and another thing in our limbic system, our amygdala is right next to our hippocampus. And our hippocampus is responsible for memory.
Memory, yes.
Right? Say, if you saw a hippo on campus, you'd remember, right? That was something that, helped us learn about the brain when we were in school.
How come nobody ever taught me that one?
Now you're going to remember it, right? So because the fear centers are right next to memory, which is very adaptive because you want to remember what you're afraid of, then what happens is trauma gets stored in our brain as fragments. especially as sensory fragments.
Yes.
That's why I get triggered by sights, sounds, whatever it may be. But if we afterwards, if we heal, if we approach the trauma, what we do is we put those fragments together into a cohesive narrative.
Yeah.
But if you avoid it, the trauma gets stored as fragments and remains as fragments, and so you're forever triggered.
And I like to think about it in terms of if you have an unresolved, say a crime or something, you're going to keep thinking about that and thinking about it because you didn't put it away nicely.
Exactly.
It's always sitting out there in parts and stuff. So you want to put it together and figure it out.
Yeah, the example sometimes that they use is, I don't know how common this is today, file cabinets,
Yes.
right? You have a folder, and let's say I took that folder and trauma happened, and so I scattered all the papers everywhere. That is a mess. And in your brain, there's a mess of different sensory experiences that your brain hasn't understood. And then again, going back to a little bit of what I said earlier, our frontal lobe doesn't, because of avoidance, which addictions and other things
Damage the frontal lobe.
exactly.
Yes.
So it doesn't put together the fragments in a cohesive narrative. What happens instead is it comes up with an incorrect narrative, what we call in CPT stuck points, cognitions about the trauma that keep you stuck in the trauma.
Yeah, it's kind of like my phone right now. I just got a new phone and it keeps coming up and telling me I have to put more information in. I keep swiping it because I don't have time, and it keeps bringing that message up
Yes.
over and over and over. I'm going to remember after this to take care of it.
Yes, exactly. So that's intrusions, and our brain is saying, hey, let me heal from this.
Let me move
heal.
on and just do what I want to do today.
Mm-hmm. And so either we completely dismiss it or we snap on kind of a quick little Band-Aid that's an incorrect cognition that we carry that narrative into the future, and it's very damaging.
Yeah. So you're educating the person how this all works. What happens after you educate them?
Yeah, so one of the key first components is we ask them to write an impact statement. And in this impact statement, it's a one-page
Is that part of the
assignment.
education or after?
So you give the education, and then their first
Okay,
homework
the first thing
assignment
after.
is they write two main things. One, why do you think the trauma happened? And I'll come back to that. And then secondly, how did the trauma impact you in 5 areas of your life? In safety, in control, in intimacy, in trust, and esteem.
Okay.
And that's to understand that these are the main areas of life that trauma impacts.
And esteem is the sense of self. Is that
So
what?
esteem of how you esteem self, but also how you esteem others.
Okay. Okay.
Yeah. So going back to why you have them write why they think that it happened is you're trying to look for the stuck points. If you
Or
say,
we would say core beliefs or irrational beliefs or something that keep coming back.
yes, and you can think about them distortions, but specifically to the trauma. So this is
Yeah.
where CBT lacks because it's very general. You're just like, hey, let's, here are a list of distortions. How does it apply to your life today? But it's not addressing these are the roots. These are like the preliminary thoughts, the incorrect cognitions that you created that are keeping you stuck both in the trauma of the past, but stuck in the present as well.
Yeah.
So you're looking for stuck points. So for example, they say, why did the trauma happen? Let's use an example of sexual abuse. And they're writing about it and they're like, I let it happen. It was my fault. And already as a clinician, it's like ding, 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 ding. That's
Yeah.
something we need to address. Why? Because if they believe that they are to blame for something that happened years ago, if you think about it, they became the perpetrator.
Yeah.
And they're living with that perpetrator day in, day out. And so later on in regular CBT, you might have distortions about personalization. You might have distortions that are related to just, deprecating self and being hard on self.
Yeah.
But you could try to heal all of that. But if they continue to believe that they are the reason why their abuse happened, it's going to come up again.
Yeah, I think I might have even used this example in another podcast, but like the kid who watches the parents fight over them. Well, they see them fight in general, but at least one of those times they were fighting was something that the kid did. And it wasn't necessarily about what the kid did, but they're fighting with each other about that situation. So the kid believes, oh, I'm the one who made mom and dad get divorced. They wouldn't have gotten divorced if it weren't for me. And then they take that belief into all their other relationships that, oh, it didn't work out because something I did or who I am or I'm not good enough or something like that.
Yeah. Now, if a healthy individual, that what they would do is they would have a healthy cognition, which we would call an accommodated belief, right? They'd say, oh, they got a divorce for this reason. Or what happened was I was abused because that person took advantage of me. And you would heal from trauma. It wouldn't continue to bother you and cause impairment. But there's other two types of stuck points, which is over-accommodated and then assimilated. Assimilated is when you change the details, the facts of the trauma itself to fit your view of the world. And one of the ways that we do that is we view the world, we call it the just world hypothesis. Bad things happen to bad people, good things happen to good people. So if I hold that belief and then something bad happened to me, I change that belief to say, well, then I'm bad, because we want to keep our world as neat and orderly as possible.
And that's actually, in learning child development, that's a very infantile view of the world too. So to take an infantile view of the world throughout adulthood is not going to work very well.
But you know what's interesting? We all tend to hold on to that belief. It's a desire that we have. And until we all experience some trauma to some degree that ruptures that belief. But some people will rather blame themselves or engage in have other unhealthy cognitions than to disrupt their view of the world.
Or even, I would imagine, too, the opposite extreme is blame everyone else.
So that's the over-accommodated.
Okay, yeah.
So I don't want to be blamed, and you may not be to blame. But then you say, to protect myself, I'm going to keep that just world hypothesis, but I'm going to say, well, all men are untrustworthy. So we identify these stuck points in the impact statement to be able, we have them do a log and write down all their stuck points. And this is so helpful because at the end of the treatment, they cross one off at a time. And it's so beautiful. I had a client today who she read, I'm going to skip ahead of time. At the end of treatment, we have them write the impact statement again.
Yeah.
And she was able to say, I am not to blame. I was present, because she was like, I was to blame because I was there. It's like, I was present, but I did not want it, right? My innocence was stolen from me, right? And her being able to say that was the healing that she needed. And that was something that happened 20 plus years ago, but it was still causing her a lot of pain. And a lot of people don't realize that those stuck points that were created early on, or it can happen in a trauma today, is what's actually causing the distress. It's not the event itself.
Yes.
It's not just, the triggers themselves. It's the avoidance that gets in the way of healing the narrative that you're teaching yourself.
Yeah, wow. I can see how that would be very helpful, because that's what we're always trying to do, is help people change the narrative of what happened, especially when it's a very irrational narrative, because it's not based on the facts.
And Amanda, the reason why so much of trauma starts in childhood is because if you think about it, children don't have a frontal lobe developed enough to have correct cognitions.
Absolutely.
Parents and others are supposed to help them, right? If let's say they say, oh, it's my fault. No, it's not your fault. But a lot of times children create this and then they start living based off of it, and then they never re-examine.
Yeah.
So when their frontal lobe is actually developed, they never re-examine these things. And that's why in therapy, that's what we do, is say, hey, by the way, that trauma that you experienced long ago, we need to address it.
Yeah.
And make sure, and so this leads to the next thing that we do, is we start challenging those stuck points. We created the log, and then one by one, and this is very similar to the ABCs. Same exact principle of cognitive disputation. You challenge you over and over again. And what I love
What's the evidence? What's the evidence against?
And what I love about CPT is it starts off with saying, okay, how much do you believe this thought? So they actually have a place where they say, I believe it, 95%.
Yep.
And then over and over and over again. And sometimes I'm like, come on, I know the truth. And you can't just tell them. It's not like Goodwill Hunting where you just say, you're not to blame, right? most people won't believe it because they've been telling themselves this for so long.
And we are the best person to tell ourselves something if we're going to believe it.
So then it goes from 95 to 80 to 70, stays at 70 for a while, and then finally it comes to 0.
Yeah.
And that's so rewarding to see because, again, if that's the root of what's keeping you stuck in life, then when you change it, then you're able to have freedom.
That's the beauty of it not being the activating event or the trauma in CPT.
Because you can't change it.
Because you can't change the trauma.
Yeah.
Like you would be perpetually stuck in that place if it were just about the trauma.
Yes, very good.
So it's like the most hopeful thing to hear that, oh, you mean people go through these things and they come out like doing really well. I mean, yeah, there's still the scar or the thought there in the back of their mind.
So
that
the
they
memory's
might,
always there.
Yeah, the memory is there, but it doesn't mean that it has to change the rest of my life, and especially in a downward pattern.
Yeah. And that's very hopeful for people because you're right. You cannot change the memory itself. Well, you can't change the actual event, but you can rewrite the narrative of the memory because a memory of this happened to me versus I'm at fault for it is very different.
Yes.
But I wanted to highlight a couple of other stuck points so that people can have a better understanding. It might be changing the idea of the actual event. So I'm to blame, or over-accommodated of like, all men are untrustworthy. But one of the most common ones I see is I'm powerless.
Yeah.
So when negative things happen to us, especially as children, we develop this idea, I'm completely helpless. Now, the truth is you were helpless as a child, or you were helpless when you got raped. You were.
Or in that situation specifically, but not entirely helpless.
Yes. And kind of an example that we do as children is, when we see a plane, right? Or let's say you're first taught things that fly in the sky are birds.
Yes.
And so the child is like, okay, bird. And the parent's like, no, that's an airplane. Then the next time the kid sees an airplane, or let's say a helicopter, they're like, it's an airplane.
Yeah.
We have very simplistic ways of thinking, but experience, if we allow it to, if we incorporate the new information, then we accommodate. And it's basically the schema theory, how we build schemas of life. But a lot of people, again, never revisited those stuck points to now understand I was helpless at that time, but I'm an adult now. I can say no to people. I can fight back. I can do whatever it is necessary to protect myself. Or if you say the world is a dangerous place, well, it happened. And yes, there is an element of truth that the world is dangerous, but it doesn't mean that it's always dangerous at all times, which you could then imagine that's going to reduce hypervigilance by a lot. So it's
and limit your options in all different circumstances too when you're making a decision.
So it's these stuck points, whether it's something specific about the trauma itself or generally about the world, about ourselves, that's kind of similar to core beliefs that keep us in that. And because of avoidance, we never re-examine them. We never rewrite the narrative, and we're never set free, which reminds me of the Bible verse, you shall know the truth and the truth sets you free. That's the premise of CPT.
Another thing I'm thinking about too with this is that if we don't take care of our frontal lobes, it's not just happening in childhood, but we're actually extending our brain childhood, if you want to, I don't know what a good way to say that is, but your child brain. We're extending our child brain because we're not giving ourselves the opportunity to grow into an adult brain that can actually separate some of those things. So... Okay, so we have psychoeducation, impact statement, stuck points. Any others?
Yeah, so one of the other major factors, and not in that order, by the way, it just so happened
We
a
talked
good
about
conversational flow, is a trauma account.
Okay.
Now, if you think back of what I mentioned of the 3 main clusters of symptoms of arousal, intrusions, and memory, one aspect of the treatment that is really important for some, especially if they have high arousal, is a trauma account. So what we do is we have them write 2 main accounts. The first one is they write through, what happened. So not the why anymore, but what happened. And you want them to be detailed. You want them to use to really think and write about sensory experiences. So I remember
So all the 5 senses involved.
Yeah, I remember walking into the room. I remember, that so-and-so came into the room later, whatever it may be. And the reason why, the idea behind the trauma count is exposure. So if you've been avoiding the memory for so long, in order for the senses to come together and integrate, for the frontal lobe now to be activated to not just change the cognitions, but to actually reduce the sensory triggers, is you need to approach it.
Yeah.
And so the first one is more basic. You just have them focus on the sensory things, what they remember. And what's really important about this, in case some of our listeners do this on their own, is to make sure to pace yourself.
Yeah.
Because a flood of emotions can resurface and it can be re-triggering. And I remember when I was training and I first had a patient do this, I was scared. I was like, I'm asking them to talk about their trauma. I'm asking them to relive it. One thing important to remind them, you're not reliving it. You have already lived it. The memory is just a memory. Because the thing is with reliving it is you have the motions and the motions make you feel as if you're there.
Just
you're
like
not.
a dream of it too, or a flashback of it. You're
A
not actually
nightmare.
living it, but you're remembering it.
Yes, and that helps people to cope. And they're like, I'm safe. I'm in this room.
Yeah.
And then they pace themselves. And what they do is they write a line wherever they have to stop. And that's really good because that tells us clinicians, where's the parts that are most triggering for them. But they start talking about the senses in a way that starts to integrate it. So it's like picking up those pieces of paper and putting it into a file.
Yeah.
Then the second one, and then they read it every single day until your next session.
You
and
get
that also
desensitized to it.
Exactly. It's the whole idea. In DBT, we call it opposite action. CBT, we talk about exposure prevention therapy. It's if you're afraid of something and you avoid it, you only increase the fear. So you approach it. Then the second trauma count again has them write about it, adds the sensory details, but then also writes their thoughts and feelings about the trauma as they're writing it today. And that helps to then also express the emotions that go along with it to also reduce the arousal and the intrusions.
Yeah.
And what's so fascinating, Amanda, and we don't have time to talk about EMDR and other forms of therapy, my clients will remember certain details that they said, whoa, I didn't remember that at all until I wrote it.
Because it's in sequence or something, and then in putting it down on paper does so much more from the memory as well.
Now, that's not the goal. Like, if someone doesn't remember the details, that's fine. So sometimes people are like, I have to remember. Like, it's okay if you don't. But what it's trying to do is, if your brain needs to remember in order to put it together, it'll do that. And then the most beautiful thing is they end up writing it, reading it, and then they get to a point where they're like, it's boring.
Yeah.
Right? It's part of my story, but it's chapter 1 or chapter 2 of my story. It doesn't have to be in every single chapter because that's intrusions, right? Trauma dictates my life. It's not about it controlling your life anymore. It just becomes, so intrusions become less, arousal becomes less, and what's left is just the memory.
I love this because even on a very practical level, if you're not going through each one of these steps, I have a client who's doing this, who's writing their story. And as they've gone through the story, there are points where like, I don't feel like writing this. I'm bored by it. I've already lived it so many times. It's like not a big deal. And then other times they get to places where they're like, wow, this brought out so many things that like I'm exhausted or sick. They even get like physically ill from it. And so you realize, oh, that's like a powerful point where you're maybe living this, I don't want to say reliving because we say you're not actually living, but you're remembering it and oh, something new's come up that you didn't address before and now you get to address it now.
Mm-hmm. Yeah. And then the last element where I mentioned before you rewrite the impact statement, what I love to do that CPT doesn't focus on, but I just want to kind of slip it in there for the sake of our viewers, is the idea of post-traumatic growth.
Yes.
Is not only does the memory become kind of boring or doesn't really have the arousal anymore attached to it, is you then take that memory and you allow it to fuel you for your future.
Yeah.
And post-traumatic growth is different than resilience in the sense of bouncing back.
Yes.
Like I'm just recovering. there's a difference between recovering and then taking that very thing and allowing it to just plummet you into a new way of life.
It's like experiences mature you versus I'm just going along and going in forward. I'm actually maturing in this.
Mm-hmm. And, that reminds me of the story of Jesus. I love this quote. Let me just find it here for a second. That talks about Jesus's death, which is really terrible and traumatic. If you think about trauma, Jesus endured trauma. It would be easy to be like, okay, that's done with. I resurrected and I'm good. But we take that experience, Jesus took that experience and rewrote the narrative to make it not just something of less, suffering, but one of significant meaning.
Yeah.
This is Luc Lezon says, terrible day, not terrible life. Hard season, but beautiful story. Awful chapter, but an amazing book. Perspective is everything. The day Jesus died was the worst and best day in history. It looked like death, but it gave me life. Your mess matters.
Yeah.
And I love that because I have seen that in the life of my patients where they don't only heal from trauma, but they take it as an experience that then just allows them to have just significant meaning. It's kind of like the story of Viktor Frankl. I quote him a lot because it's beautiful. He says, to live is to suffer, right? He quotes it in his book. But he says to survive, or I like to say thrive, is to make meaning of that very same suffering. Right?
Yeah. Those are the best stories too.
It is.
I don't want to say obsessed, but I love stories where people go through very difficult times. There's a lot of them in the Bible, but I love reading books where people who go through difficult times and something arises out of that. And some people call it, beauty from ashes or whatever, but
the
you realize
rough.
wow, what wasn't to kill me actually thrilled me. And so, and even the, Genesis 50 verse 20, what you meant for evil, God took and made for good.
Yes. And I love, I remember the first time a client told me this and, I've heard it before, but when they said it themselves, they're like, God doesn't waste pain. God can't protect us from all pain. And maybe we can have an episode that talks about why bad things happen.
Yeah.
Because that is part of the healing journey of understanding that. But God takes the pain, right? He's not the cause of it, but he didn't cause it, but he uses it for a cause. And so I encourage people who have experienced trauma to start viewing their trauma. Well, first off, really directly approach it and heal from it. And then start viewing it as a blessing, not the pain itself, but what can come out of the pain.
Mm-hmm. And that's a hard thing to tell somebody who's not there yet.
Yeah, you don't tell them in the moment.
No, but it's the promise of if you work through this, even you won't understand now what can happen.
Yeah. One day.
I love seeing people get to that place where wow, I didn't believe you. I didn't think this was going to work, but I think this is actually helping. Or wow, it's really helped. And I see things so differently. It's like taking the blinders off too.
Yeah.
So, well, this was an awesome episode. Thank you for explaining to us what CPT is.
Yes.
And I just hope and pray that everyone who's listened, that if you have somebody that is, needing that support to go through their trauma experience in a way that shows that can be some beautiful things that come out of it, that, maybe they'll be interested in trying CPT, and you'll have to find a therapist who knows about it too. So thank you for listening and joining us. Thanks for listening. To hear more episodes, find us on social media, or support us financially, visit thebrainpeoplepodcast.com.